Shock and confusion. That's been the reaction from many African governments and aid organizations after US President Donald Trump ordered a freeze and review of foreign aid. Despite a reversal on life-saving aid, particularly for HIV treatments, it remains unclear what will happen after the review. Questions remain about what else will be funded and who exactly will receive it. But here are some key facts you should know. The US is the world's largest single aid donor and a key provider of humanitarian assistance to Africa. So a freeze or reduction in aid could have devastating consequences for millions and put lives at risk. Now, last year, the United States provided nearly $7 billion in humanitarian aid to sub-Saharan Africa. That's according to USAID. Now, this funding covered a wide range of support, including HIV prevention, malaria treatment, agricultural assistance, and initiatives to combat the effects of climate change. In 2024, UN agencies received the largest share of funding, totaling over $3 billion, followed closely by US government bodies and US-affiliated NGOs. So it's a big deal. Despite the waiver on HIV treatment, health and humanitarian organizations worldwide remain uncertain about if and how they can resume their work. The specific programs covered by the exception remain unclear. Malawi, in particular, heavily relies on support from the United States government, especially for its health services. Take this clinic, for example, in Blantyre. It's fully funded by American aid. Patients rely on this clinic for essential HIV medications provided through the PEPFAR program, which currently appears to be secure. The budget covers everything from staff and equipment to facilities. However, there are concerns that a freeze on US foreign aid could force such clinics to close, threatening critical health sector jobs, and most importantly, putting thousands of lives at risk.
I take these drugs and my daughter does too, so it would be a disaster if they stopped. Maybe for me, I am old enough, but what will become of my daughter? In this case, her future is undecided, so it is my plea that this aid must continue. I am deeply worried because if we stop taking these ARVs, we will surely die. My life is dependent on these drugs.
The treatment for HIV is a very fragile process, and just small delays of hours can have devastating effects and cause the virus to re-emerge. This is how one nurse at the Blantyre clinic described the situation if there are disruptions in drug delivery.
The supply that we have will end in February, and we have no clue how we shall assist these clients. If the drugs are not available by then, it means more lives will be at risk. They will develop a resistance, and that will be catastrophic. Their health will worsen, and many people will die due to unavailability of these ARVs that they receive free of charge.
Right. Many health workers and NGOs are clearly worried about the future. Dr. Catherine Kyobutungi is the Executive Director of the African Population and Health Research Center in Uganda. I asked her what would happen if the US ceased its funding.
If the funding is pulled and it is done suddenly, what happens is that the millions of Ugandans who are getting care through these various programs, now all of a sudden the programs have stopped. At the second level, it means that the people working in these programs have lost their jobs. And today's headline in the local daily says about 2,000 people have lost their jobs overnight. And these are people working for the big non-government organizations that were using this development aid now to provide services. Wow. So the losses are two levels. The people who are HIV positive, who can't get treatment, who can't get tested. But then it's also because the job losses in a lot of organizations that were delivering programs through this development aid.
Wow, that is staggering, to say the least. We actually called several people from the health industry and no one wanted to talk. Understandably so, there's a lot of confusion and chaos going on. What is the feeling at the moment amongst health and medical workers right now?
I think it's the biggest feeling is disbelief that this could happen. And no warning, no transition, no bridge. It's just like you're running a program and then you're told stop everything. And it's actually been devastating for some organizations because if you largely depend on US government funding, and then you're being told to lay off your staff and to stop doing what you actually do. So if you have patients that are on treatment and you're told to stop it, what is supposed to happen to them? So it's mostly disbelief that something could happen so suddenly without any consideration of the potential consequences, not just for the people who are getting care through these programs, but also for the people whose livelihoods depend on these programs because they're providing a service to Ugandans and other Africans. So I would say if people are too busy to talk to you, it's because they are fighting fires, they are trying to figure out what to do with their staff, what to do with their project. They have offices in different parts of the world. They have patients who probably showed up to the clinics there and there was nobody. So everybody's in crisis mode. And so I wouldn't be surprised if people don't have time to speak because it's been devastating for some organizations.
Right, which is why we appreciate that you actually made the time to try to break this down for us. But crisis mode activated clearly, but are there enough emergency funds that countries can rely on in the meantime?
I think it's hard to say whether countries have these kinds of funds to rely on because the cuts are not just in HIV, they're in malaria, they're in health system strengthening, they're in health information systems. So it's very hard to see where the funding gaps are going, how they're going to be plugged, especially when governments had already finished their improvements. They're already in the financial year, so this is not money that they expected to spend from their own internal resources. Yeah, so it's hard to see how this is going to happen, but yeah.
Maybe this is serving as a wake-up call, right? How can African countries move away from this heavy dependency on foreign aid?
I think it could be a wake-up call, but I think it's a wake-up call in countries where there are stronger governance systems, whether there's stronger accountability of governments with citizens. But a country which is not accountable, it may not be a wake-up call at all. And maybe that's the major area of concern. That, of course, inevitably, if the funding is not reinstated, countries will have to figure out how to treat people with HIV, how to treat malaria cases. But this is something which might happen better when they start a new budgeting cycle, which starts for most countries from July to June of the next calendar year. So that's possible. But between now and July, when the new budgets kick in, then, of course, a lot of things are going to happen. So it's still early days. We've not seen what countries are planning to do yet. There's a lot of information gathering. There's a lot of consultation with different partners. But at least I'm not aware of a country which has come up to say, this is what we're going to do and this is where we're going to get the money to plug the gap which has been left. So I think things might stabilize when there's an opportunity to budget without expectation that there will be $300 million coming from PEPFAR for the Kenyan government. But for now, I think the crisis is going to be the period between now and when the new budget cycles kick in. And it's going to be devastating for people. They've been talking about resistance, but it's just, that whole thing that you're HIV positive and you can't get care.
Right. Troubling times indeed. Dr. Catherine Kyobutungi, Executive Director of the African Population and Health Research Center. Thank you very much for your time.